Okay, the VR platform that I chose to research is called UBSim, and it is a virtual reality nurse training. So kind of an overview. Again, the VR platform, it's called UBSim. And the topic that I chose to focus on was a Health Science 2 class, specifically the Standard 2.0 that states understand healthcare safety and infection control procedures. So the learning context here would be high school Health Science 2 students who are learning about personal protective equipment or PPE and how proper usage of that equipment helps promote safety within a hospital or medical environment and how it helps prevent infections. So an overview of the product. UBSim is an immersive virtual reality platform, and it provides simulations for nursing education programs, and it allows the learners to practice actual patient care, make clinical judgments, and practice that professional communication in very realistic clinical scenarios. It is a fully immersive virtual reality. It is simulation based. It also, in addition to only one person being in the simulation, it does allow for multiple people to be in the simulation at one time. It also allows for people who are not in the simulation to be viewing what is happening on screen. So it would be great for also a facilitator-led observation. So some of the key affordances. So the spatial immersion is definitely there. Learners, when they are in the program, they are standing in a hospital room with an actual patient. And learners are using those controllers to do things like administer medications, assess vitals, and handle equipment, medical equipment. Again, it does have like a multiplayer feature, and so this really helps enable a team-based care scenario. I feel like very rarely is it just one person in a hospital room or a medical setting. So that's also a very valuable skill for those nursing students to have. And again, they're dealing with realistic patients, and the responses that they get are dynamic. So that's really also what helps make it VR. Participants are physically moving throughout the room. They have controllers that they are reaching and actually interacting with things. And they're doing things again like administering medication, assessing patients, and communicating verbally with the patients and also anybody else that may be in the room. The patients and the environment that they're in when they're in the simulation, it responds dynamically to their decisions. So it really helps create that true to life clinical experience. And it's not just, we're going through the motions and doing this, and no matter what we do, the outcome will be the same. So this is the demo. We do not have access to this platform at my school. So I have just found a demo from the company on YouTube. So our learning objectives here, so what I envisioned for this Health Science 2 class is, as you saw in the demo, there were various scenarios that students could complete. But for this specific class, really focusing on one of the tutorials that talks about that protective, personal protective equipment. So our learning objectives for this Health Science 2 class would be students will be able to demonstrate professional communication and ethical behavior. Students will be able to apply infection control and safety procedures in patient care, and students will be able to analyze vital sign data and respond to clinical changes. So in this lesson, before the virtual reality even comes into play, students would have to be taught about infection control and PPE protocols, the donning and doffing of that PPE. Also, professional roles is a very big thing in CTE courses, and specifically in the Health Science 2 course. One of the standards is being able to communicate effectively. So again, before the VR even comes into play, the teacher would need to review professional roles and communication expectations with the students. I do think it would be a good idea for the teacher to lead some demonstration on just basic program controls and navigation, and also demonstrate just basic headset safety and space boundaries. During the virtual reality simulations, the students would be doing things like practicing that correct sequence of donning and doffing personal protective equipment, according to safety protocols, also practicing those clinical judgments with simulation tasks. And then once students had kind of mastered that, then they would be able to proceed to go to some more in-depth patient care scenarios. After the VR, I think this gives students a great opportunity to reflect on the decisions that they made while they were in the simulation, and whether that would be safety decisions, ethical decisions, or just their clinical responses, and talk about what did they do well, where could they have improved upon, and also just completing a wrap-up connection, a wrap-up that connects the simulation to those Health Science 2 standards. So the pedagogical connection here, I feel like this is a great example of embodied cognition, and that theory states that learning takes place when students can engage in physical interaction with an environment. It's not realistic to take a group of high school students into a hospital room and let them practice on patients in hospitals. That's just not a realistic thing. But with this simulation, students are able to do more than just think about the clinical procedures. They're actually able to physically reach for equipment. They're actually able to interact with a patient, and act like they are the person in charge in the room. And so this really helps engage them and connects what they're doing with their body, making those connections with their cognitive process. So some critical issues and risks that could come up with this platform. UBSim cost around $11,000 for an annual subscription to the program, to the platform. Programs would also have to purchase VR goggles. Now, UBSim is compatible with any Meta VR headsets, but that would be another additional cost for the program. And so that would be not only a big cost to renew that annual subscription, but that would also could potentially be very expensive to keep having to buy those headsets and buy the amount of headsets that you need for a class. Also, another concern would be limited classroom space. Because this is such an immersive platform, virtual reality platform, and students are required to move around and interact so much with the space that they're in, it might be difficult to find that space in a high school classroom setting. And then I feel like with any virtual reality headset, program, physical discomfort is always, a risk. especially if it's a lengthy simulation. They may experience things like motion sickness, eye strain, or fatigue. So some possible ways to mitigate those issues with the access and cost barriers, especially for the headsets. I feel like it's very realistic for schools to start with only a few headsets and then, be able to add to that as the years go on if needed, and really being able to find available grants to help fund for that large subscription cost. And there are a lot of funding opportunities for CTE when they need specific equipment. So I do think those things would be possible to find. For the limited classroom space, if there's a larger space like the library or another common area in the school that teachers would be able to reserve on the days they know they're using the VR headsets, that would be something they could do. Or even just if they could figure out a way to move their desks on the day that they're doing the simulations, to kind of help create that safe zone within their classroom. For the physical discomfort, I would start with shorter simulations to kind of get used to it, to the eye strain and the fatigue and the motion sickness. I would also make sure that those headsets are adjusted to fit well on the students' heads. But if there was a case where a student could not wear those for some accessibility reasons, providing an alternate assignment is always an option as well. So why VR? For this, I feel like, again, it's not a realistic ask to take a group of high school students and dump them in a hospital setting where they would truly interact with real patients. So I feel like this really gives those students an opportunity to start practicing those skills and those communication skills with patients in a realistic setting very early on. They don't have to wait until they're almost through a program in college before they get that experience. So this really strengthens, student engagement. Again, they're getting real clinical experiences, and it's not just them watching a video of someone else doing it. They are actually doing it. So it really just helps with them being engaged and getting those real life experiences. And the discussion question that I would end with, it says, does immersive VR simulation improve nursing students' clinical decision making or mainly increase emotional engagement?